Let's maybe shift gears now to cancer. We know it's good for the heart. We understand the mechanisms causing this cancer. So what have you seen in the clinic? Do you have cancer patients?
So I'll take it first, Tom. Yes, I've seen several patients with cancer who come to me. Sometimes it's basically the Hail Mary. You know, they come in, they say, I'm at the end of my rope. I don't know where to go. Everyone has said that there's nothing else
I've had
I
chemo,
can
I've had
do. Oh
radiation,
yes, all of it. I've had those types of patients, and some who have been actively involved in their care and have taken their own time to look at what other possible therapies I can add on or use with, as I walk through this cancer journey. So we have both kinds of types of patients. I've seen patients who have reported to me that they have had the tumor size shrink during the course of maybe 20 sessions. I've seen that 20, and changes in their skin pattern in certain inflammatory breast cancer. Maybe I'll think. I believe in several therapies. I don't believe in monotherapy. So I really discuss their diet with them. So we try to talk about ketogenic diet. We talk about possibly adding IV therapy, high-dose vitamin C to their treatment, hyperbaric therapy, so pro-oxidative treatments to help them kill cancer, basically. And it also, hyperbarics also helps with radiation therapy and with chemotherapy as far as how effective chemotherapy and radiation can be with the adding hyperbarics to their treatment.
On the radiation necrosis, right? That's one of the FDA cleared indications, so it should be
Radiation
reimbursed.
necrosis.
Yeah. So it should be cleared, and so I understand. Elena, your belief is throw everything at it, because it's all doing something, but together it's very powerful.
Yeah.
So we don't need to be in a clinical trial on hyperbarics with cancer. What we need to do is to get rid of the sugar, high dose vitamin C because of the benefits that has. Hyperbaric oxygen. You also you recommend and use the beamer,
The pulse electromagnetic field.
So you throw the kitchen sink at it, they get better, and that's all we care about.
And that is what they care about too. They don't really necessarily just say, I just want this. I want to see how everything I do will help me as heal through this very difficult time in my life.
And what have you seen, Tom?
Well, it's interesting, and what Elena said was timing is important. Timing of the hyperbarics in conjunction with radiation tissue damage, or radiation, and also chemotherapy.
Yeah.
The radiation tissue damage is a long-term thing. It occurs maybe 3 to 5 years after radiation. So you see that down the line, and usually by that time they have had the cancer-free diagnosis, because that happens at about 5 years. With what we have seen in active cancers, so we've seen individuals that have come in with brain cancer, glioblastoma, that were given 9 months or 3 months to live. And one individual I'm thinking of right off the bat was an individual that came to us, and he's now approaching his second year after that.
With hyperbarics.
With hyperbarics involved in his care. Now, he was doing a lot of other things too. I'm not saying it's a standalone, just like you said. Right. But the incorporation of hyperbarics, we want to make a tumor happy, okay? A happy tumor is a good tumor, okay? An aggravated tumor is one that grows, okay? And if you can actually give hyperbarics, you can actually deliver oxygen, which then interrupts the metabolism of the tumor. It also will actually, most of the inside of tumors is hypoxic. So if you add oxygen to that, then it actually will counteract the growth of the tumor too. Yeah. So in this condition, I can tell you that it's been amazing in what we've seen. Am I out there saying, hey, listen, we're at cancer therapy? No, we're not. Hyperbarics is a tool, and it's a tool by which we can deliver oxygen to tissues in critical need. Now, a lot of people have added snake oil to it. In 32 years, I've had unbelievable responses from physicians, and I'm sitting there going, it's important that you understand the role of oxygen in healing. I would think that would be a priority of teaching a healer. Some of the ancient healers said, let food be thy medicine, or the patient, listen to the patient, because the patient will tell you how to cure him. We've gone away from listening. Mm-hmm. The other thing is, and I think that there's a report out, it's called the Flexner Report. I like history. This was done in 1910 where they redid medical education. And one of the things that comes through that report is that we're actually going to emphasize science. Now, the practice of medicine is actually an art that's supported by science. And if we actually rely on science, first off, what is good science? After the last 2 years, I'm not sure we know, okay? The last 2 years and the COVID vaccines and everything that's going on here, who knows what the true story is? And what the special interests are. Politics and special interests come into creating things that influence the science and also influence how medicine and the art of healing would occur. So what I would say is I would ask the doctors to, hey, listen, practice your art. Practice the art of healing. Use every tool available to you, and you'll see outcome, especially when you use and look at the role of oxygen in healing. Mm.
Well, I think one of the things that you both brought up here is that cancer is, you could use the term as anaerobic, doesn't like oxygen, right? So
Tumors don't. Yeah.
Tumors don't like oxygen, so you introduce oxygen and sugar. They rely on sugar, and so that's why the diet is so important. Food is medicine. All of these great things. It would be nice to see that. And one of the things that you brought up, Tom, is we don't really know what good science is, and in our research, rundowns, we try and point out if there's a conflict of interest to the researchers, and separate from that, to me, when we talk about COVID and long haul and all this other stuff that's going on, they silenced the scientists, to a large extent, the real scientists. And we had the media saying, follow the science, but never pointed out what science. So I think they destroyed the concept of that science is important in to me, this very hidden agenda that possibly was going on. But if you actually go in and read the science, and I know you do that, there's a lot of good science out there, and it's just being ignored, or when it's summarized by somebody that may be paid off because of a conflict of interest, they conclude something that's completely inaccurate. And that's what we try to point out in our research rundowns. And so I don't know if you've experienced something similar to that, but
yeah. The thing is, and I come to it from a different perspective, okay? In universal healthcare, actually, universal healthcare is interesting. And when hyperbarics was studied in the role of treating cerebral palsy up there, part of socialized medicine actually is we're going to get people well so that they can pay into the system, okay, because the system pays for everything. When you look into context of how hyperbarics was studied there, okay, 111, the largest study of children with that type of injury, and it was clear: improvement in gross motor function, improvement in fine motor function, reduction in spasticity, improvement in cognition. This is game changer. Did it cure the disease? Or it's an injury, it's not a disease. Did it cure cerebral palsy? No, because the kids still have cerebral palsy. Mm-hmm. Did it improve and save the government money? Well, that's questionable in how you determine cost, okay? What was apparent is we've got all these children that are impaired that probably will never re-enter the workforce, so therefore saying that we're going to treat this group of people does not have an advantage in a socialized medicine. And that's something that the science did not pull out. The individual that wrote the largest study, he was brought in by the government. He never saw a patient, never saw one, but he wrote the study, okay? In that, they actually compared, and one of the articles I'm going to review in a later segment is they looked at the Montreal Colette study as a randomized control trial. They had two study groups that were pressurized oxygen and pressurized air. Both elevate the amount of oxygen they were given. Both groups significantly improved. However, it was viewed as a negative study. To the parents, and I can speak from that because I have two stepsons that were born with twin-to-twin transfusion, and they developed cerebral palsy as a result of it, which is kind of a deprivation of oxygen at the time of birth. They've lived with challenges. At age 4, both of them were in wheelchairs, okay? Both are legally blind, okay? The thing is, with hyperbarics and the administration, just 24, one step from the wheelchair has never been back. Okay, the other one gained trunk control so he could sit up independently and could open his hands and feed himself. Today, that was at age 4. Today, they're 27 years old. They've had well over 1,500 treatments, okay? Probably that's due to a lot of part on the
parents.
The family they were born into.
The mother.
the mother, right.
The drive of a mother in caring for her children.
Yeah.
And the thing is that one graduated from college, and the other one has and works in community awareness and talking to new patients, new citizens to Quebec and teaching English as a second language.
Interesting, wow.
So, I mean, and just recently we were able to go on vacation and left the one in a wheelchair in the house by himself for a whole week. And he took care of himself for a whole week. That's pretty impressive.
Well, they might not be able to, like you were saying earlier, contribute directly to the workforce. However, their family can continue to contribute to the workforce because they're not home taking care of them the whole
Right.
time. So there's one aspect of that.
Just to one of your earlier points, so when they were born and they had to do the transfusion, and I understand they were premature, they were born early, had they gone into hyperbaric right away, would they have any of these issues?
You know, that's again an issue of timing, and there are a lot of the physicians that are involved in hyperbarics that say that if we treated it early, you could you could actually eliminate cerebral palsy, or the impact of cerebral palsy
On society,
medicine
on
today.
society, yeah,
Yeah.
as a whole. And how many children are afflicted with cerebral palsy? Is it worldwide? It's a big number.
It is a huge number, and it also takes a lot of, let's just say this, it takes a large toll on the family. It takes a large toll on society too. You know, every 3 years you're replacing a wheelchair. That's $15,000 that the government pays for.
Wow.
Okay? In socialized medicine, it's a little bit different, so here it's different too. But anyhow, that's kind of.
Well, we're working down the list, and number 3.
I wanted to mention one more thing,
Sure.
if I may, with cancer, and just go back to that, because I just wanted to say that patients also come in for chemotherapy side effects. So we got the brain fog, mostly brain fog, really. And so they come in thinking they're just coming in to get more clarity, but they also get improvement in their biomarkers for cancer as an effect. So they're coming in for something acutely happening. For instance, their cognitive function just isn't as good as it used to be. Or we can also talk about the wound that they have maybe from a mastectomy or something that's been tumor debulking, and their wounds improve and heal better, faster. But I just wanted to mention that as a chemotherapy side effects and radiation therapy side effects, hyperbarics can really also play a big role in that, in addition to actually addressing the tumor biology. So.